Hi, Dr. Lindsey here. In this video, I'm going to explain to you why we tend not to do a gentle curve joining the top of the hair to the sideburns. And this is a somewhat common request that I get from patients, and I always have to explain why we don't do that. And so this is why. So, I've been doing hair transplants and facelifts for 29 and a half years, and we've done about 4,400 hair transplants. And our goal is not to make it look remarkable, but rather to make it inconspicuous that anything's been done and just have you look like you're a person with hair. So we don't create a normal hairline by trying to create the perfect hairline. We try to create a hairline that will age reasonably and look unremarkable upon close inspection. So for most guys that, class 3, 4, 5 hair loss, would need a lot of hair up in the top and the front, I generally draw a hairline that's pretty similar to what I currently have, because it looks unremarkable and I just turned 60. And so in this picture you'll see that top line is I drew on this man roughly what my current hairline is. And then almost everybody of every age tells me to bring it down somewhere between 1 centimeter, that's a half an inch for us Americans, to 1 inch, depending on really what age they are and how much the hair they have to work with and what their likelihoods of going further bald in the future. And then once we agree on that hairline, we put some irregularities out in front, because God just doesn't make straight lines. You drive by a forest and you don't see a straight line of trees. You see some small trees and then the forest starts. So the same thing with hairline. We want some irregularities along the hairline. And this is how it turns out on a representative case at 13 months here on this side. So if you go to any textbook on how to design a hairline, or any online article, and here's 2 examples, pictures that I just snapped off the internet, it shows that people have this curve that I've never seen in person, and if it's Christmas season, I would challenge you to go to any mall and just sit someplace and watch people walk by and see whether you can see any man that has a natural curve there. And I don't think you're going to be able to do it. If you do, snap a picture and send it here and we'll give you a hearty well done. So we don't do that curve, except on Sikhs who have auto-extracted their hair and some women who have auto-extracted their hair. But for your average male patient, I'm very reluctant to do that for 3 reasons. One is, if you look at the hair right here on somebody's head, it tends to be kind of the weakest and, quite honestly, crappiest hair on your head. And if you're transplanting good hair from back here, it simply doesn't match well. Secondly, these hairs, like your eyebrows and mustache or beard hair, lie quite flat with respect to the skin. Here's your skin, here's the hair, so it's flat. Whereas up on your head, it's more obtuse. And even though we can take a scalpel and make an incision at an angle and plant those hairs at an angle, almost always during wound healing, there's some contracture and those hairs get tilted up. And so again, they don't really match as well as you, the prospective customer, might think they would, or what it would look like in a picture or a drawing. During my fellowship, I can remember specifically some ear reconstruction techniques, and I was asking my teacher, why don't we do them that way? It looks so easy in the drawing. And he goes, you can draw anything. To get it to work with actual flesh is somewhat challenging. And I remember Dr. Davis went on vacation for a while, and I was already almost at the end of my fellowship, and so I got to fix an ear, and I did it the way it was in the picture, and he was correct. Pictures do not always equate to the way things work surgically. And then the third reason that we don't do that is that you typically lose some hair behind that. So let's imagine we put some hair right here when I was 40, and then you lose hair behind it. Then you have this patch of hair that really doesn't quite match, followed by some skin and before you get to the good hair, and it almost looks like the peninsula of Florida. It looks silly. and it's difficult to keep chasing that. So here are two examples of patients that we did not do, but whom I use as examples to try to explain to people why we don't do this. So example one's a younger guy who's got pretty good beefy hair to work with. He went to someplace and he had a reasonably good hair transplant up top, and they put some hair here, but you can see that he lost hair behind it, and so it looks like the peninsula of Florida. The hair isn't lying correctly, and the hair is not the same caliber. It's remarkable, not unremarkable. And then example two is a younger fellow who went to a facial plastic guy that dabbles in hair. I'm a facial plastic guy, and at one point, a long time ago, I dabbled in hair, and you get poor results when you dabble in anything, whether it's hair transplants, fixing cars, doing facelifts, brain surgery. You really have to make it a vocation that you do all the time. And so unfortunately, this doctor that he went to did this gentle curve, and you can see that it looks unnatural. The curve doesn't look right. There's not enough hair there. I think he had some SMP put there, which makes it look even worse. And now what are you going to do about it? You're going to put more hair around it. You're going to FUE those out. You're just chasing your tail with that. So in summary, we don't do a gentle curve, and we try not to do much in the way of the superior temporal tufts, because you can't get it to lie right, you lose hair behind it, and the hair is not the same quality. If we can help you, please give us a call.